All right. We should be good with our interpretation choices. Yes, great. All right. Hello and welcome to the Playbook on Advancing CHW Engagement in COVID-19 and Envision's first monthly training webinar. I am so excited for today and grateful for the opportunity to be in community with you all. My name is Leslie Wolf. My pronouns are she, her, hers, and I'm the Mobilizing Action Toward Community Health Group, also known as MATCH, Community Training Manager. And MATCH Community Training works to evolve practice, focus priorities, and shift power to support collective action on root causes of health and equity, and is part of the University of Wisconsin Population Health Institute, where we accelerate capacity to create equitable conditions for everyone to be healthy by advancing knowledge, practice, policy, and systems change across sectors. I've had the great pleasure of working with the Population Health Institute since 2008, delivering equity training for communities, health departments, and organizations with an emphasis on coalition and community power building. And the Population Health Institute is the coordinating organization for Envision Equitable Healthy Communities Training and Technical Assistance Center. So if you want to advance the slide, please. To start off this time together, I want to highlight some agreements for the kind of learning culture we want to create. So to start with, thank you. To start with is complexity, that there are multiple truths and a truth is not the same as the truth. Curiosity, that we really lean into what we don't know and struggle together. Voice, that we participate thoughtfully and make space. And I oftentimes think about this acronym that was taught to me by a fellow coach called WAIT. Why am I talking? So a good thing to consider and when we think about thoughtfully using voice. And also similarly, why am I not talking, for the times when maybe I really should be using my voice. And then one of my favorites is non-closure, that we'll go where we need to go and be where we need to be. And we can offer first drafts and build from there. And there will be many starts to conversations and ideas that we'll want to continue. And that's okay, because we don't have to finish it all today. Additionally, just some operating agreements for how we use Zoom, that we stay on mute when we're not talking. When talking, say your name, please. Turn video on if possible and comfortable, but no judgment if it's your preference to leave it off. That we use the chat box for questions and comments. And actually, Kara Abshir will be available to answer any immediate needs and capture any additional questions that we have. And some of those we may follow up with after the webinar. And then most importantly, do what you need to do to take care of yourself. So, move about when you need to move about, take restroom breaks or bio breaks or whatever it is, eat food, drink liquids, have fun. So the focus of today is on the playbook, but we'll start off with an overview of Envision's Training and Technical Assistance Center's approach to supporting the CCR2109 recipients. And then the CDC will review COVID-related resources that support CHW COVID response and resilient communities work. And we'll then have the Community-Based Workforce Alliance to talk about the playbook, very exciting. And we'll then have an opportunity to choose a breakout and dig deeper into one of the 10 playbook areas of engagement. And finally, we'll wrap with next steps. And we're gonna begin and end today with a quick pre-post evaluation poll. So I'm gonna cue over to Jen Park-Marak, who's part of our Envision team, to open up the polls for y'all, and we'll ask you to please do a pre-assessment, and we'll be doing the same thing post. And then I'm going to hand it over to Andrea.
Hi, good afternoon, everyone. My name is Andrea Hayward. I'm a community health worker and also the director of the Community Health Worker Institute at the Center for Community Health Alignment, and so excited to be a part of the Envision team and to tell you very briefly a little bit more about our training and technical assistance approaches. So a little bit about who we are. The Envision team is a collaboration between community health workers and community health worker allies with the goal to work together to elevate the role of community health workers. And so this work is supported by the CDC as we're recipients of 2110 funding. Our process for TA is framed from an equity lens and not just in terms of successful implementation of CHW programs, but really in centering and uplifting the expertise and experiences of community health workers and communities served. And so with that, we can go to the next slide.
Can I ask my fellow co-host to not touch the poll window?
And so with that, thank you, Jen. Envision has three core elements that really frame our technical assistance and TA support: individualized coaching and support, peer-to-peer learning opportunities, and training. And I'll tell you a little bit more about that if we could advance to the next slide. So our TA process is collaborative in nature. We are in process of hiring or recruiting for community health worker coaches who will support 2109 recipients to co-create training and technical assistance plans. Additionally, coaches will support recipients ongoing through connections with community health worker subject matter experts, trainings, and resources. This would also include connecting recipients to each other through peer-to-peer learning opportunities. Next slide. So to note that 2109 recipients are able to request TA through AMP, and additionally, technical assistance needs will emerge as recipients work with community health worker coaches. Individualized coaching plans will be developed in partnership with recipients, and these plans really will support the overarching goals for CHW program implementation and highlight coaching strategies, training needs, tools, and available resources. Next slide. So the peer-to-peer learning opportunities are, we're very excited about this opportunity actually to have recipients share and co-learning with each other on emerging themes that may be happening as we're in practice in implementing our programs. And so with that, it really will be driven by what we see and hear from 2109 recipients and an opportunity to really share and learn about various topics, whether that be community clinical linkages or building statewide associations and networks. And so that's really a snapshot of what we'll offer. And with that, I'll hand it back to Leslie.
Thank you so much, Andrea. So I want to talk a bit about our training approach. Envision's training will support participants to obtain the necessary knowledge and skills for an equitable and effective CHW workforce response to the COVID-19 pandemic through accessible webinars like this one that are responsive to the current context of our work, and partnering with subject matter experts to provide current information and resources. In addition, we're going to offer cohort-based learning collaboratives, and Envision's cohort-based learning collaborative is really rooted in principles of equity and power building, focused on strengthening the collective leadership capacity of 2109 recipients and the CHW workforce to create partnerships, policy, and system changes that ensure every community reaches its full health potential. This means building skills and engaging with community from the beginning, exploring root causes, thinking about how to create sustainable change, developing a collective action plan, and building strong multi-sector partnerships. Teams composed of 2109 recipients, CHWs, and community partners will move through a curriculum that builds a national coalition focused on sustaining the CHW workforce. And we know that each participant comes to CHW work with distinct experiences and perspectives, and we want to build on those through a combination of pre-recorded webinars, web-based learning community sessions, and workshops inclusive of coaching, peer-to-peer learning, and training will support community-based teams in building the skills and partnerships to establish and lead an aligned agenda for sustaining the CHW workforce. Thank you so much, Dr. Nahi. And as we know, the reason we're all here and the purpose of this work is to build an equitable and resilient response in communities that are hit the hardest. And one solution is CHWs and building a sustainable CHW workforce. So with that, I'll turn it over to the Community-Based Workforce Alliance to talk about the playbook and what we need to integrate CHWs.
Is Alex Quinn with us? I don't know if she's having trouble logging on.
Yeah, I was just looking through the list.
I'm
Thank
here.
you, Denise.
Okay.
Sorry.
Oh, okay. Happy to go
Hi.
forward.
Yeah. Can you hear me okay?
Yes.
Okay. Hi, everyone. Sorry for the long pause. I'm Alexandra Quinn. I'm part of the Community-Based Workforce Alliance, the CEO of Health Leads, CHW, but a junior one compared to my colleagues on the CBWA. It's just been the past few years that I've been able to, mostly on vaccines, be a CHW. But I'm really thankful to be on this call with all of you and appreciate that every Zoom call right now is just another Zoom call. And so just thankful you all are with us, that I've been asking our team, are you running, dancing, limping, or crawling to the end of the year? I think at every given moment, I'm probably a mix of it. And imagine that for many of us on the call that you've been doing the work to actually enable people to be healthy, for our health and healthcare to be a little more equitable. And that means that a Zoom call on December 16th is not always easy. So just deeply appreciate you all being here. I'm going to give a quick intro to the Community-Based Workforce Alliance. I think it's almost beginning of 2020, when a colleague of ours who runs Health Begins, Rishi Manchanda, made a call to a few of us and said, COVID had just started hitting the US shores. We knew, all of us, because of our day jobs, that community health workers and community-based workforce had to be part of the effort, the movement to start to address what COVID would bring, not only in terms of sickness, but also in terms of just unearthing for many who don't see the health and healthcare systems every day, how inequitable it was. And so for those of us that live this world, and all of you, we knew that something would need to be radically different in order to be able to handle COVID at all. And that maybe, just maybe, we could also do some systems change, maybe actually make systems more equitable through COVID. I don't think Denise, me, Rishi, Alex Fajardo, others, Aurora on the phone, ever expected that we'd have an alliance 2 years later. I think we got a bunch of organizations together to think about how to better do and make sure that CHWs and community-based workforce were centered in response, and racial health equity was centered in response. And we launched this alliance. Today, almost 2 years later, we are a formal alliance. I think we have over 30 members. We are starting to think about structure and how we're going to move on and have a fiscal sponsor and continue to bring more people in the fold. And really our part of our vision was response, but really also about rebuild, and this deep feeling that we didn't actually ever want to go back to how health and healthcare were delivered in the US, and that could our collective groups actually create something different moving on. And so that's the origin story. I'm really thankful to be joined by several of my colleagues, and we're happy to answer other questions later on about the Alliance too, but really want to focus on the playbook and supporting you all today. I think, am I passing it off to Alex next? Is that right?
Actually, Denise, you're going to.
Denise.
Thanks. Next slide. Okay, so today we're going to move through an exciting sort of initiative that came out of our alliance, which is the Playbook document. As Alex said, our focus with our alliance is that our response and recovery efforts are not have to be embedded in communities, or else they won't be either equitable or effective. Quickly, just to introduce myself, I'm a community health worker. I'm the founding executive director of the National Association of Community Health Workers and a proud co-founder of the Community-Based Workforce Alliance. Next slide, please. So our alliance was built on principles that were first lifted up by Health Begins, and we want to briefly cover these items for you because these principles over the last 2 years have been found and I think tested to be critical of looking not just for recovery and response in this moment, but in true transformation, to Alex's point, around racial and health equity. We're looking beyond the moment into a movement of transformation that centers community expertise, leadership, and capacity. And so the principles that we lift up in our alliance that all of our members adopt focus on recruiting. That means engaging your workforce, frontline or otherwise, with a racial equity lens. Investing in trusted workers, and often that means not just hiring individuals, but it also means developing equitable and authentic partnerships with community-based organizations, with CHW or promotora-led organizations, strengthening those connections with psychosocial services. I think we'll talk later about the disproportionate impact that we know was present before the pandemic, historic inequity, persistent disparity, and how we begin to change our framing to address some of that work by addressing the whole health needs of individuals, families, and communities. As we seek to develop systems and strategies that bring communities out in a way that could be healthier and more resilient, we think about the opportunity to launch this community-based jobs program. And so each of you in the moment of managing and administering and developing your own initiatives can begin to advance these principles. Thinking not just to the workforce that you need now for COVID response, but the workforce that you need to address the wicked problems in your local, county, or state level communities, and how you can begin to develop a jobs program that brings diversity, equity, and inclusion, brings community expertise into the workforce. And then finally, thinking again about the moment of COVID and the investment that has come through the federal government into states, counties, and local health departments, and thinking about ways that you can leverage those dollars, those partnerships, those infrastructures, those programs currently to braid funding that again addresses broader inequities and real barriers for people to achieve health and well-being. So while folks are struggling with COVID-19 and positive public health behaviors of keeping doors of economies open and keeping schools open, we also have to consider that people need access to safe and affordable housing, that people need nutritious food, that people need access to healthcare coverage. And there's other funding in the state that can help address the same communities that are disproportionately impacted by COVID with some of this braided funding in your state. True equitable initiatives can be lifted up. Those are the principles that we espouse and that we offer to you. Next slide. And so we have 4 activities, won't spend too much time here, but our day-to-day work is focused on advocacy on behalf of a broad community-based workforce, including doulas and peers, community social workers, promotoras, and many others. We do a range of communications, webinars, and reports and blogs. We're constantly monitoring bright spots and looking at areas where we want to elevate and lift up what's working in states, and also looking to data and ways that we can sort of track and confirm equity, and providing support and technical assistance like we're doing now with the Playbook. Next slide. Okay, and our key values, this was obviously at the heart of, I think, what has grown our alliance, is that we are affirming the dignity of all human beings, that we're demonstrating through our membership and through our initiatives, a commitment to racial equity and an anti-racist agenda. We're amplifying the expertise of the community-based workforce, and many of our leaders and members are representative of the workforce themselves, as well as allies. We do some capacity building, as I mentioned. We're trying to stay nimble in time as our environment continues to shift, and we're committed to creating a space of transparency and candor. Next slide, please. So what is the problem that we're here to address, and why is the playbook an important tool? Since the first US diagnosis in January of 2020, COVID-19 has impacted the physical, mental, and economic well-being of the general US and global population, with particularly painful assaults on our elders, our frontline and essential workers, low-income and rural communities, people without safe and affordable housing or access to healthcare, precarious workforce, and precarious communities. COVID-19's disproportionate harm on persons who experience historic vulnerabilities. These include our Indigenous tribal nation members, Black, Latino, Asian American, Pacific Islander, Hawaiian, and Alaska Native populations, should be considered in the context of a collective failure to really coordinate strategies at every level of government, state, and local and community, to really integrate our expertise into the initiatives and our response. Next slide, please. So what is the way forward? The way forward really needs to be built with community knowledge, with community voice, and in authentic partnership. We have hope in the power of widespread distribution, misinformation campaigns, which are so important so that people have factual information to make the best decisions for their families and for their communities. But we know we have continued challenge in this work. And so we're changing our idea of what is normal in terms of our community engagement strategies, our communications more generally. We are hoping to leverage resources in a more equitable way to really redeem the time that we were in before the pandemic, where tens and tens of millions of people were without health insurance, or they were underinsured, where we had high rates of underlying conditions, chronic disease, and where we had tens of millions of people who were really precarious workers. We want to build trust. We want to expand access and ensure equity. Next slide, please. And community health workers are central in this work. We're going to focus in today on this broad title. When I say community health worker, I am lifting up the history and expertise of promotoras and promotoras de salud, our community health representatives from tribal nations, our peers, our outreach workers. There are dozens of titles, liaisons and navigators, titles that are familiar to you in your state. But there are sort of common qualities and competencies of this frontline workforce. We are trusted members of the community. We're experts in community health. Oftentimes we have lived through and are survivors of some of those same inequities or disparities in chronic disease or in a broader social context. CHW should be engaged as necessary partners in your work through all of your key activities, not just as downstream actors, but really in your response strategy, including all of the coordination of health, behavioral health and social needs services, community-based and home-based testing, vaccine readiness, education, misinformation campaigns, the navigation of social resources, etc. Next slide, please. So CHWs have a rich history. We don't have time today to sort of go into all of what that is, but our history, our collective history in the United States goes back hundreds of years and is really representative in coming out of nearly every kind of community, people who are justice involved and cancer survivers and people living with HIV/AIDS, and those who are from immigrant and refugee communities, those who've worked in migrant farms, those who, like myself, were HIV street outworkers, or people who are trying to build capacity and education around policy change to address some of the social determinants of health. So we're working across ethnicity, across geography, across sector. You'll find community health workers in many different places in education and mental health and chronic disease, maternal and child health, working in housing and food insecurity, et cetera. But we are also preservers of well-being, of health concepts, of language, of culture. We are advocates, capacity builders, we're healers, and we're known by dozens of different work titles. Next slide, please. Just before I leave you, I just want to say that CHWs are a proven workforce. We have over 6 decades of evidence of our effectiveness in chronic disease intervention, immunizations, oral health, and many other areas, as confirmed in a number of randomized controlled trials, systematic reviews of different ROI studies of CHW interventions. And increasingly, we're also recognized for our contributions to addressing racial equity and the social determinants of health by connecting individuals to basic needs, by organizing communities to address inequity in social conditions. During the COVID-19 pandemic, obviously, you can see from the slide, we've been providing a range of both downstream and upstream services and leadership through coalitions and networks at the local, county, and state level, providing a range of direct service, designing misinformation and health education campaigns, launching and developing trainings, helping to integrate our expertise into this broader response. Next slide, please. So that is sort of the backdrop and the expertise and leadership that we bring into the development of this playbook. The playbook was developed by members of the community-based workforce and our allies across these 30 or so members in the Alliance. And right now I want to turn to one of the other steering committee members, Alex Farhado, who helped to create the playbook and who's going to go through the specific components for you and how you can begin to go from conceptualizing the playbook and the roles of CHWs integrated into your COVID response to really operationalizing that work through this tool. So thank you.
Thank you so much, Denise. This is Julie Smithwick. Actually, I'm doing the first part and then I'm going to hand it over to Alex. Thank you so much for that backdrop. So my name is Julie Smithwick. I am also a community health worker. I am the director of the Center for Community Health Alignment here in South Carolina. And I'm very excited to be part of the Envision Training and Technical Assistance team and to be getting to work with many of you going forward on technical assistance around best practices for community health workers. And the majority of our team is made up of community health workers. So we're very excited to be community health workers offering support to organizations of community health workers and allies of community health workers. So today we're going to talk a little bit about this toolkit that is a great place for folks to start and to be able to advance in your knowledge and your support of best practices in the community health worker field. Next slide, please. We have a short 3-minute video, and then I'll fly through the next few slides that'll just give a little bit deeper look into this tool.
I absolutely believe that public health departments are trying to do their very best, and community health workers can really be allies to public health departments in this fight.
We're like the bridge that can connect both the health providers and the communities with resources.
We're like that drop of water that keeps landing on the rock until it makes a hole. We're like that. We're consistent. So by us being consistent, the community gets to trust us more. And they know that if they need something, we're here for them.
We are able to get connected with the community, and there are people out there who are struggling prior to COVID and now with COVID.
If I'm a local public health department and I'm thinking, you know, how do I build a workforce that's capable of responding to COVID, but who can also address the root cause issues that cause chronic disease or the opiate crisis? That's who community health workers really are.
We're in the middle where we can just speak to both sides and explain in detail and hopefully get them to understand each other and come together, and the community members receive the care and services they need and they should receive, and the health providers are able to receive more knowledge about how to treat these communities.
We've put out a new document, a playbook that we think will be useful for public and private institutions that are interested in more authentic community engagement, specifically leveraging the roles, capacities, and expertise of community health workers. It's called Advancing CHWs and COVID-19 Response Strategies, or also known as the Playbook. The National Association was proud to partner with the Community-Based Workforce Alliance. This playbook is important for you to provide you guidance on how to conceptualize and operationalize CHW engagement in your COVID-19 response. The Community-Based Workforce Alliance is proud to endorse this playbook, and I'm encouraging each of you to consider it to drive health equity, to drive more authentic community engagement, and to really promote sustainability in your COVID-19 response strategy through partnerships with community health workers and our networks, associations, and coalitions. Thanks so much for your time.
Visit the website below to access the playbook and to learn more about the Community-Based Workforce Alliance.
Awesome. Thank you so much, Jen. So quickly, so that we can get to have enough time in our breakout rooms and dig into this a little bit more, I wanted to share with you what the playbook looks like. Hopefully many of you have had a chance to check it out. There are two major parts. The first one is the framework for engaging with community health workers and our organizations across key areas. And it explains a continuum of engagement from limited or harmful engagement to moderate, to mature, to robust engagement. The second part is about strategic recommendations for advancing along that continuum. Next slide, please. So these are the areas that are covered in the playbook. And like I said, in a few minutes, you're going to be able to choose a breakout room to dig deeper into one of these topics, but the playbook actually covers all of them with a good deal of information that has been written, again, by folks in the CHW workforce who have really dug in and dialogued about best practices in our field. Next slide, please. So again, this is the framework. It shows how to advance on this continuum from limited or harmful engagement to robust, and it gives you strategic recommendations to do so. Next slide, please. So this is an example of what you'll see in the playbook. This is the increasing intensity of engagement around the role definition of a CHW. So what you'll see, for example, in the limited or harmful engagement category is that there's no mention of CHWs within any documentation, or there's a brief mention of CHWs, but without any further guidance. Then you'll see what moderate looks like, and then what are some examples of robust engagement. So robust engagement with CHWs in terms of the CHW role definition says that the roles and capacities of CHWs are explicitly recognized, that the roles of CHWs include all items from the CHW Core Consensus Project, including those specific to COVID-19, and so on and so forth.
So this tool helps you understand where you are and how you can advance in your equitable engagement of CHWs. Next slide, please. The second part are strategic recommendations. So again, going back to the community health worker role definition, we saw what it looked like to have limited or harmful to moderate engagement, such as not relying on CHWs to design our roles and expectations. Then it gives you suggestion to how to move towards more moderate to robust engagement. For example, the CHW Core Consensus Project, relying on that expertise to base information on the roles and scope of community health workers, and then requiring that hiring decisions of community health workers be made only after approval by CHW peers. So again, some really applicable tools to help you move along in that continuum. Next slide, please. So here are a couple more examples. I won't go into them. We already looked at role definition, but again, you'll be able to see in terms of tools to move towards more robust, equitable engagement of community health workers. They're listed within every area of engagement: role definition, supervision, training, and so on. Next slide, please. So one great way of how to start by using the playbook is just to take a real honest, open look at where you guys are right now. And it's okay that you're not completely in the robust or moderate stages right now. Many folks are starting off, and you may start in one place, and that's okay. The goal would be to look at where you are on each one of these areas right now. So you'll see on the left-hand side of your screen, part 1, where it says framework for engagement. Your team can sit down and say, okay, where are we at in terms of these definitions for role definition, supervision, compensation, career investment, and so on, and determine where your team is currently, which is what you see in the red. So this team realized that in role definition, they're actually in limited engagement, but in recruitment, they fall in moderate engagement, but green is where they want to be. So they want to move from limited engagement of role definition to moderate engagement. So then they can take that information and move to step 2, which is then following up on the strategic recommendations to move from one category to the next. So hopefully that makes sense, and it'll make more sense as you go through the playbook. Next slide, please. So now I'm going to turn it over to my colleague, Alex Fajardo, to tell you a little bit more.
Thank you, Julie. Thank you, everyone. My name is Alex Fajardo. I am the director of a nonprofit in California, implementing community health workers promotores since 1991. And also we do training and technical assistance across the states. As Julian I was explaining about the tool, the playbook, it's important to understand, to identify the level of engagement that you have, and how you are going to be moving from limit to really robust. So I think it's a process that you need to have, and also identifying realistic recommendations to advance your team along with this approach. So depending on the engagement from the leadership of whoever is implementing CHWs will be the impact on the project. So it's super important that everyone on the project really gets involved on analyzing and really do the assessment on the level of engagement, and see how they can increase intensity of engagement, moving from one to another one. I think it's important just to have this important clarification before I give some examples, because whoever is going to be doing the work really needs to be involved in the conversation and the finding, as well the leadership of the team. And the idea is to assess the functionality of the program's components to any CHW-based initiative. So in this case, really is you are going to be finding one page that is going to give you which items do you need for engagement, and then also is providing you some examples of strategies to advance in that engagement. So as soon as you identify what areas you need to work on, this page of the playbook is going to be giving you some examples in how to move from one to another one. This is just ideas in how to do it, but you can develop your own strategy. So we put some of them there, for example, in role definitions. Like, for example, look at it about the C3 project. So identify, be familiar with recruitment as well. We put some ideas, but the main idea of this is the advancement. This is just to facilitate the advancement from the different stages of this continuum, from one level to the another one. And this is an strategic recommendations for making discrete improvements across all of the areas of engagement. It is super important as well to understand where you are and where you are going to go, and defining the activities that you want to go. You can go to the next slide. We have a few minutes left. So where to use this playbook? So the users has been used for local health departments. We have been presenting to a lot of local public health departments across the nation, local, county, even state-wide, in how to use the playbook and how to incorporate CHWs as part of the work on this pandemic. Also, we have been having advising community-based organizations, and then also community health clinics. It's important to really understand these sectors, or whoever is working on the clinic, and how has been used. A survey, so you can use this tool as well if you want to do a survey, for example, compare CHW service provided by local health departments to identify gaps and needs. This playbook also can help you to identify which questions you need to have in order to keep or identifying a survey. Or, for example, for planning and review, inform and review CHW's program design, or if you are contracting CBOs, this playbook also is going to be giving you some ideas in how to really do the support for the CBOs that are going to be working, implementing the project, assessment, improvement, and capacity building. So it's really, this is a tool that you can use in order to assess yourself and increase a capacity in all of the 10 aspects of the playbook. So I highly recommend it, that you took some time to review with your leadership, with your team, and define how you can use it as well. So next slide 2. This is just an example of the agencies that have been using it, and we have been able to provide some support as well in the implementation of the playbook. And as Julie mentioned, we're going to be going to the breakout rooms, and you can get deeper in each of the concepts. And then the link is there already on the chat. There is a long version of the playbook with a very detailed and some links to resources, but also you can we have a small or shorter version that you can share as well with your team. So thank you so much, and we go back to the organizers, and looking forward to talk in the break rooms.
Thank you all so much. So we'll have an opportunity now to get into breakouts to dig a little deeper into this, into the content. And based on the information y'all provided at registration, we created the following breakout options. So there's program evaluation, training and professional development, healthcare integration, community partnerships, role definition and supervision. And then we also will have an open space with the CDC and Envision. So someone from the CDC and someone from the Envision team to support any of those questions or needs that don't necessarily fall into those categories around the playbook, some of the non-playbook related questions that you might have. So Jen has set up those breakouts, and how it will work is that you're going to, if you click on the bottom of your screen, I believe it should be on the bottom of your screen, you should see something that says join a breakout. And then you should be able to elect into a room. If you have any trouble with that, we will have someone hanging out in the main room to support you. And welcome back, everyone, from breakouts. We're just going to do a quick wrap up here. Just a few things to note. I hope y'all had great conversations in your breakouts. So a few things to note. Our next webinar is January 20th, 2022. And we are focusing on vaccine equity. We're going to have NACHWA back for that. And we'll likely have more CDC COVID resources at that point as well. And it will be open to all 2109 recipients, program staff, and all CHWs involved in the work. So that'll be January 20th, 1:30 to 3. Also, we want to be sure that y'all have opted into the listserv for future trainings and job posting announcements. I think that that's going to end up in the chat there for you too. One of the job announcements that we wanted to highlight at the moment is that we are hiring for an Envision program manager. So that should be, we can also add that in that link in the chat for y'all. So please distribute widely, get some good applicants in. And then finally, we did get a number of wonderful questions in the chat today. Thank you so much. And in our breakout sessions as well. So we're going to take all of that. We will do some follow-ups with emails for what we're able to follow up on right away. And then if there's any immediate needs, anything that's come up for you really more urgently or immediately, please use AMP for those TA requests. Am I missing any wrap-ups there?
Poll.
Oh, that's right, the evaluation poll. Okay, we're gonna do a closeout poll. So this is a post-webinar poll for y'all. And then while we're getting that up, John, if you could advance the slide. And really just want to say thank you so much to NACHWA and to the Community-Based Workforce Alliance, the CDC, and the other 2110 recipients for co-presenting on this webinar today. And thank you so much to all of you. This was really fun, and it was great to get to meet some of you in breakouts, and really looking forward to seeing y'all next time.